Hey guys, welcome to Respiratory 3260. This next video is a little bit not 100% gospel. It is securing and care of a RAM nasal cannula. You will find each facility does this differently. This is just one way to skin a cat. So learn from different facilities, different ways of doing it. This is just one method to secure a RAM cannula that I have found is beneficial for me. But again, learn different ways, see different things in clinical, and here we go. So as usual with our videos, we're going to go over our equipment. You have different size RAM cannulas. They come in packages that look like this. White is the smallest. It's micro preemie. I used it once. It's super tiny. Next we have our preemie, which is green, our neonate, which is blue, and our infant which is orange. So the smallest to the largest. You will also, if you don't have to use it, but I love this skin barrier film. It helps make things stick better and it protects the baby's skin. At least a minimum of 2 alcohol wipes. 2 pieces of Duoderm that are cut like lima beans or circles. 2 Tegaderms, it's 1 Tegaderm cut in half of the small size. And if it is indicated, you can have what's called a Septal H, which can help prevent septal breakdown if you are having this issue with the RAM cannula. It comes in both an infant and a preemie size. They also have these pieces of Velcro in them that you can attach to the bottom of the RAM and to the bottom of the Septal H. I personally don't like them, but it is what it is. Okay, so let's set up our baby so you can see their face. So we have a brand new baby that comes in with respiratory distress. This is what an open RAM cannula looks like. If you notice, the size of the bag also matches the little adapter here. We have an adapter here that can attach to a wide variety of respiratory modalities such as bubble CPAP, Drager, that you'll attach right on to provide support. And then we have our prongs. So the manufacturer says you want 50% narrow occlusion. I found it's more beneficial to have more of a 50 to 80% narrow occlusion because we're still going to exhale through the mouth. But I don't want to provide breakdown, so that's why I say 80. So this will allow for higher pressures while you're delivering CPAP. So let's say we're worried about this kid's septum getting rubbed on. First, let's say we're worried about this kid. I'm going to wipe off with alcohol wipe because freshly birthed babies, nothing sticks to them because they have brand new skin. You're going to take your Septal H. This is a pretty small baby, so we're going to use the preemie one. You take it off. One side is sticky, one side is not. You apply it to the lip like a mustache. It is at this point I would apply the Cavalon. Up the septum, but you don't want to block the nair, and then it wraps around the nose. So that if you are using a different interface, such as maybe a Drager mask, it would protect any breakdown from happening both up here and down here. So that's why it's made as a Septal H. Okay, after that, I'll make sure my Cavalon or 3M or barrier is applied to the cheeks. I'll stick this in the nose, make sure I have proper occlusion. I'll take my first jelly bean and attach it. I lied. I put this on in a minute because I want this right up against the skin. I'll put it pretty close because there can be breakdown by the nair there. Bring it up and around. And the reason we cut it into a little bean is so that we can avoid the eyes, avoid hurting the eyes. And then I put my septal H on top because these septal H's get a little gooey and they're changed more frequently than the duoderm. So that's why I would put it on top. Do it to the other side. Lift that up. Apply to your baby's face. And make sure it lays down nice. Put it down. Okay. Next, I will take the remainder of this. It comes in like a little lollipop. It should still be wet while you're doing it. I'll put a little bit more on here because, again, especially if we put in the eye ointment that we give after deliveries, it can get kind of slimy. So I'm using everything I can. I want to try to position my ram in the nairs as deep as I can while also not going right up against the nasal septum. So I'll come out just a little bit. Take my Tegaderm. And I found if I put my pointer finger here, I can slide that across to my thumb. And then I apply the Tegaderm onto the duoderm and seal it down. And then I do the same to the other side. Pointer, thumb, and apply. Oh, don't drop your baby. Okay, after that you'll see it's holding and it looks pretty nice. A little trickeroni I learned is you take another alcohol wipe and you can seal it down to prevent any air bubbles, so then A, it looks nicer, and B, it is more secure, because then you have less chance of moisture getting in. So seal it down. So a few things with ram cannula care. Every time you go in to assess your baby, you want to make sure that there's no breakdown with and without a septal H. You'll probably change the septal H pretty frequently, which means you'll have to change the Tegaderm frequently. But because hopefully the duoderm stays in good condition, you can just change the Tegaderm and not frequently change the duoderm to protect the baby's face. This also will help prevent any breakdown or anything like that against the skin. So to this end, I will make a video about bubble CPAP and NIPV and IPPV for neonates. But this is where you would attach that. And that is ram cannula care and attachment. Well, one variety of it. So we will see you guys in class.